what would you think will be the future of private healthcare sector if your recommendations are implemented?
See, in the recommendations, there are 3 tiers talked about. Primary tier. Who are the people who are going to provide the primary care?
MBBS.
And private sector or public sector?
Public sector.
Private doctors, publicly funded.
Okay.
These are not government employees. This is private practice. The pharmacies, who will maintain, run them? Private sector. The diagnostics, already in Andhra Pradesh they are doing it. A company, private company is taking care of the diagnostics very well. Medall. So, private sector. But publicly funded. See, we are getting confused between public provisioning versus public sector. Secondary care, all your Arogyasri model, who is providing the care? Most of it? Private sector. So the only area where I believe private sector is not viable for the time being is tertiary care. The poor people seeking tertiary care interventions, there my belief is you spend more money on the public hospitals. You take for instance your Usmania or Gandhi, the 2 well-known government hospitals in Hyderabad, teaching hospitals. Typically, if there is a sanctioned strength of say 1000 beds, typically there are 1800 or 2000 beds operating. Operational beds are nearly double in government. Because too many patients are thronging, they are demanding admission, they have some problem or the other. The superintendents and the doctors have no choice, so some floor bed, or they ask people around, get some charity, some bed. After all, bed is only a few thousand rupees physically.
Sharing the beds.
Sharing. All kinds of things happening. On an average, per bed, operational bed, the money spent in a government hospital, teaching hospital is 8 lakh rupees. That includes medical college and nursing college expenditure. Whereas in private sector, the billing per bed per year will be minimum 30 to 40 lakhs, in many cases 1 crore and more, high-end hospitals. Their government must put more money, judiciously, improve systems of accountability, and attract the best private doctors to come in so that they get quality care. Those 3 things. And limit the tertiary care, free tertiary care with government expenditure to those hospitals. That's all. That's the only limitation of the private sector. Otherwise, primary and secondary are essentially private sector driven but publicly funded. And in India, given our social structure and the current conditions, the people who are better off anyway will only use private sector, no matter what you do. Conceptually, you make it universal care, but they have their insurance, they have their family doctor, private doctor, they trust them, they can afford to pay. And as our incomes increase, the paying capacity increases. Therefore, private sector continues unchecked. We must encourage private sector. I'm a great believer in that. I already mentioned to you about $14 billion is the billing this year for the overseas patients. This can easily become $100 billion in the next 10 years. In fact, even faster. That is much more than all the total healthcare billing in India today. That alone, overseas billing alone. So private sector will continue to grow, but the poor will not have to depend on payment in private sector, in tertiary care. That's the only limiting factor. So this will be good for private sector. This will be good for the poor people in the country and the middle class in the country. And as Indian incomes grow, we can move towards more and more insurance model, even for tertiary care. But right now, for tertiary care, that's not the right model. I gave you the reasons.
Sir, you are planning to meet some chief ministers and discuss regarding the our recommendations.
Absolutely.
So, how far are you in going there?
No, first we are spending time to create some kind of awareness among the doctors, among the intelligentsia, the media, etc. Slowly there will be some kind of a buzz, some understanding. Simultaneously, we are talking to the officials in governments, and we will meet the chief ministers very soon. Andhra Pradesh, Telangana, Tamil Nadu, Karnataka, maybe Orissa, and some other states. And I am sure that the Telugu states are far ahead of the rest of India because we are the pioneers in Arogyasri, etc. So they will embrace this because there are also votes in this. There is a political gain. If you implement it, you get votes also. So as in Telugu it is said, Swami Karyam and Swakaryam.
Hi, this is Taman.
Hi, this is Shraddha Das.
Hi, I'm Priyadarshi.
నేను మీ ఆది.
Hi, I'm Kashish Vora.
Hi, నేను మీ శ్రీ విష్ణు.
Hi, this is Aditya.
Hi, this is Naga Anvesh.
Please subscribe to Social Post.
Please subscribe to Social Post.
Please subscribe Social Post.
Please subscribe to Social Post.